Hi, guys, and welcome to our first chapter in our abnormal psych uh, class. Hopefully, you can hear me. I'm out on my porch, and there are crows who are suddenly very loud. But hopefully, you can hear me over them, and they're maybe nice background noise. So, in the first chapter, the things I want to think about together are how we define and think about mental disorder, and I want to think together about the role of stigma in how we think about mental disorder on a day-to-day basis, and also just a little bit of the history of how over time we've thought about mental disorder. So let's start just by thinking about these definitions, and you and I are going to come back to these a lot. So I want you to really kind of pay attention and make note of these someplace, because we are going to use these over and over throughout the course to think about where we draw the line between something that is significant or interesting or problematic, but maybe or maybe not a mental disorder. So let's just go through these four, but I want you to really think about these and think about what questions you might have about them. So the four that you can see in front of you, we'll take one at a time. Personal distress, I think, is pretty straightforward, right? That's the person is upset about something. That might be that they are feeling anxious and very directly feeling distress as a result of their disorder, or it could be that they're experiencing secondary distress, and so they have a personality disorder, and that's resulting in unstable relationships. People don't stay with them, and that's causing distress. But either way, they're presenting unhappy or uncomfortable in some way. Um, Disability is the idea of being unable to fulfill role obligations of some kind. And so we think about disability most when we think about work, and certainly that is a form of disability, being unable to be successfully employed. But disability would also be being unable to take care of your children, or perhaps unable to take care of yourself. So all of those things would be disability of some kind. And so when we have psychological disorder, we have some symptoms that create that disability. And I should pause here and say, you and I, you're going to hear me a lot when I talk about symptoms, that I'm going to make every attempt to use the term or the phrase behaviors and experiences. Symptoms are symptoms only when we decide they belong to a disorder, right? And so we'll talk about criteria symptoms, things that would count towards making a diagnosis. But really, from the person's point of view, what they're experiencing, what they have are behaviors that are problematic, or experiences, internal experiences that are problematic. And so I want, you're going to hear me go back and forth and point that out a lot also as we go through the course. So our third point here is the violation of social norms, and that is about what social expectations are. So if I never leave my house, I am violating social norms, right? That's not typical. If I can't get on a plane because of fear, that is atypical or a violation of social norms. If I can't maintain relationships of any kind, and I never have any friendships or other social relationships that last more than a few months, that would be a violation of social norms. And so it doesn't have to be that I'm deliberately violating them, but that my behavior falls outside of what typical behavior is within my culture. And we're going to come, I think this is an important thing to keep in mind, is that it is for your culture, and so there will be different norms for different cultures. And one very important job of a psychologist is to always be mindful that if you're seeing somebody who was raised in a different culture or is living in a different culture, that their social norms may be different, and the fact that they violate your idea of social norms may not mean that they're violating their own cultural group's norms. And we'll come back to that when we talk about diagnosis in a couple of chapters. And then the last thing here is about dysfunction, and sometimes it's hard to differentiate between dysfunction and disability. But dysfunction is not about what you're able to accomplish. Dysfunction is about some internal process that's not working well. And so that might be that you're hearing voices, that your brain is processing auditory information in a way that's making you think you've heard something when you haven't, right? You may still not have disability. You may be able to, you may be able to fulfill role obligations, fine, but that's still something that's happening that shouldn't be happening that way. Your inability to sleep or your inability to wake up in a timely fashion, right? That might be dysfunction. So it's things like that. And all of the experiences and behaviors, all the symptoms, so to speak, that we're going to talk about with each of the psychological disorders that we'll touch on for the rest of the semester, are going to have to meet these four, or at least most of these four, in order to be considered a disorder. So again, we're going to come back to these again and again. When we think about disorder, though, in the discussion that I've outlined for you, and some in our live discussion, we're going to talk about this some more. But this idea of stigma, and to just define stigma, right? Stigma is a label, it's an undesirable label. People with a label are seen as different and are often discriminated against. And so this isn't something that's inherently true about the person, right? That might be prejudice. But this is a label that others apply to the person. And so in this case, we're wondering about the stigma associated with somebody who has a psychological disorder. So we apply that label of psychological disorder, and then we think differently about that person because they have that label applied to them. And I want you to think some in your discussion about what role fear plays in the development of stigma. And I think it's really important, and I want to talk about this with you guys more in the live discussion, to think about how we react and think differently about mental illness than we do about physical illness. And so you might think about how you would feel about being diagnosed with a psychological disorder, or maybe how you have felt if you've been diagnosed, right? So what it feels like to be diagnosed with a psychological disorder as opposed to being diagnosed with something like diabetes or high blood pressure. Or lupus or something like that. And then also how we react when we find out somebody else has a psychological disorder. And so if I'll ask you in one of your reflection papers to think some about this, but to start thinking about that now is if somebody tells you that they have schizophrenia or bipolar disorder, how you might think about that or react to that information that might be different. And then if they came to you and told you that they had diabetes or lupus. And so, we're going to be talking about these more. You're going to be writing about these more. But this is an important thing to think about because stigma plays a big role in how we think about mental illness. And one of the examples I always use is I do have a psychotherapy practice, as I think I've said to you guys somewhere. And my psychotherapy practice looks a lot like other psychotherapy practices, which is that there's a waiting room. It's a private practice, a solo practice. So if somebody comes in, they're sitting alone in the waiting room. It's not a shared waiting room. And so there's a waiting room that has a white noise machine in it, so that to make it hard to hear what's happening in the office. The office also has a white noise machine to make it hard to hear what's happening in the office. You might find those in some medical practices, but not as consistently as you find them in psychotherapy practices. I have what I think is an awesome element to my office, and it's one of the reasons I rented my office, which is that I have a separate exit to my office. So when I am done with a session, my client exits through a back exit that goes down a staircase and out to the parking lot, so that they never go back through the waiting room. And that is not necessary, but I find it desirable. My clients find it desirable, right? Because it increases their sense of privacy. Excuse me. And so thinking about, how often we sit in doctors' offices, even specialist offices where people might guess what we're there for, we don't worry about who else is in the waiting room necessarily, not at least the way we might if somebody saw us coming out of a psychologist's office. Now, that's not going to be true for all of us or all of the time, but it is true for more people than it is, the number of people who feel that way about psychological practices is higher than the number of people who feel like that about medical practices. So I'm going to stop here, and we're going to pick up in a second lecture to talk some about the history of understanding psychological disorder. So I'll see you there.